everyone, welcome to my channel. This is your favorite nurse NG. If this is your first time of coming across my channel, please kindly subscribe, leave a comment, like my video, and you can as well share it to everyone around you. You don't know who you might be helping, who might come across my video, and it will be a lot of help to them. So today I want to share with you four essential things that you need as a parent with a child less than 5 years of age. Even if you are not a parent yet, this video is still important. You can learn and save it, so when you get to that stage, you can make use of it, and you can as well share it to parents around you. You don't know, they might not really know about this, and in that way you help them, you save the life of their baby. Okay, so these four things are very essential as far as you have a child that is less than 5 years of age. As far as you have a child that is a toddler, it is very, very essential, because these children, they don't know their left from their right. They cannot differentiate. They don't know the difference between poison and juice. They don't know that this is bad, this is dangerous. They don't know. Anything and everything is in their mouth. Everything they lay their hands on, they tend to put in their mouth. And that's why in the label of some medications, or in fact every medication, you will see they'll say keep out of the reach of children, because they don't know. They will think that it's juice. They will think that is something edible, and they will take in, they will consume that thing, and it could be very harmful. And then aside that, they don't really know what is called hand hygiene, except you teach them. And even if you teach them, they are not well developed enough to adhere to whatever teachings that you gave them. So whatever, they will touch dirt and everything, and then in their mouth, and they will come down with illnesses. So these items are very important. It will help you in taking care of them, managing them when they have some of these illnesses. Okay, so number one is activated charcoal. Activated charcoal is something that you use in a situation whereby the baby taking all these chemicals, harmful chemicals like jig and some things that shouldn't be drank. So this activated charcoal will help to neutralize the harmful effects of that chemical. So you need it in your house, and this activated charcoal is only active within 1 hour of consumption of whatever dangerous substance that baby took. So after 1 hour, the activated charcoal will not be effective. So immediately you notice that your baby ingested something or drank anything that is dangerous, please rush and get your activated charcoal. You see why it is necessary for you to have it in your home. So you get it and give it to the baby, then you move to the hospital immediately. Then the second thing you need is your ORS, oral rehydration solution. You need it. It comes in sachet. They sell it in the pharmacy store, so it is very, very accessible and available for you to get around you. So you can walk into any pharmacy store and then you ask them, you can get it. So when the baby or when your child is having diarrhea, in a situation where the child keep on passing loose stools, it's not just stool, but loose watery stools, multiple times a day, what you need is this ORS. You don't need Flagyl. Some mothers, the next thing they will go to get is Flagyl. No, because as the baby is passing this watery stools, the baby is losing fluid, is losing electrolytes, and this is the fastest way the baby can, die. This thing is what kills the baby, because of the fluid and electrolyte that the baby loses in the process of, going to toilet multiple times. So you need this ORS to replace the electrolyte and the fluid that the baby is losing. That's why it is very, very important. So you give the baby the ORS at each passage of watery stool while you go to the hospital. Then the third thing you need is paracetamol. It's very, very important. Imagine your baby is having a very high fever in the middle of the night, and there's no nearby hospital. You can't get to the hospital at that time. What would you do? This is where your paracetamol comes in handy, and then you can be able to give this paracetamol to the baby while you wait till morning, and then you go to the hospital to actually find out why your baby is running temperature. Because in the actual sense, fever is not a disease or a sickness. Rather, it is a sign, it is a symptom of an underlying illness or something going on in the body. So while you give your baby the paracetamol, you then go to the hospital to do further tests to find out why the baby is running temperature and what is actually going on inside the body. So paracetamol is very, very essential. And the next thing is thermometer. Yes, because you cannot really determine the temperature by just laying your hands on the baby forehead or on your child forehead, because you can actually mistake normal body warmth, to fever. You might think that the baby or your child is running fever, but just the normal body warmth due to temperature changes and weather changes and all of that. So the best and the most accurate ways to find out, to know if your baby or your child is truly running temperature, is by checking with thermometer. It is very essential. So when you check and you see that, oh, the baby is reading up to 38 or 40 Celsius degree, then you know that really, really, the baby is running temperature, and it's not just ordinary temperature, this is high fever. Then you proceed to the hospital, or you can give your paracetamol while you then make your way to the hospital. So these very four things are key. They are very, very important. If you think that I missed out one or two things, kindly drop them in the comment section. I want to see them, and others can also see them, and it will help them to know.